both sides of the aisle, both houses of Congress, are really setting their sights on PBMs and the lack of transparency within PBMs and how that's driving up drug costs. And the Senate Health Committee was going to consider some legislation this past week to really try to provide more transparency and oversight of PBMs. But this gets into the process side of the equation. This was supposed to be a very bipartisan process, but some last-minute snafus about process and some members feeling like they didn't have time to really review what some of the other senators' amendments were doing and whether or not an agreement to really keep this bipartisan was being broached, kind of threw this up into turmoil. So I think they're regrouping, and next week hoping to pass this legislation restricting some of these anti-competitive contracting terms that are in contracts between group health plans and providers that say, you know what, we're the biggest game in town, hospital system, and you got to take one of us, or you're going to take all of us. And also, you can't steer your patients. You get all this information from transparency about providers that are lower cost and higher value, higher quality, but guess what? You can't make any benefit design changes that are going to steer your employees toward one of those lower cost, higher quality providers. So there's legislation, bipartisan legislation, that I think is actually being introduced today that is going to stem and restrict those kind of hospital anti-competitive terms. What we're seeing is this, hyper-partisanship in Washington and legislative gridlock that comes from that is more regulatory activity at the federal level. If the White House is saying, well, we're not going to be able to get our agenda through Congress, we're going to try to push it through the regulatory agency. And we're also seeing more and more state activity. And I think this is particularly important, this growing trend that we're seeing at the state level and healthcare, legislation around pharmacy benefit managers acting in a vacuum because Congress hasn't acted. And that's all well and good, except to the extent that this is really cutting in ERISA and the ERISA preemption. And states are pushing that further and further and further. And I think that could have enormous implications for employer-sponsored coverage and the necessity for self-funded plans to really be able to rely on ERISA preemption to be able to provide benefits nationwide on a harmonized basis. I think just the lack of access to in-network, particularly mental health providers, is really fueling a lot of scrutiny by the administration and Congress on employers and plans' compliance with mental health parity requirements. And I think that what we have tried to explain and ask for repeatedly is, we need clear guidance. We need to see from the standpoint of the Department of Labor, what does compliance look like? What does compliance look like with the requirements of this comparative analysis comparing your mental health services with your med-surg services? Hopefully, I haven't checked my email in now about 30 minutes, but the Department of Labor is supposed to be issuing new regulations that will helpfully provide some more guidance. But I think that mental health parity is going to continue to be a focus and an issue until, figuring out a way to really expand access to mental health providers, build the mental health network, and also figure out a way to have more mental health providers in network.